Tummy tucks, the way we refer to that in plastic surgery is an abdominoplasty, but it's easier to say, more fun to say tummy tuck. Again, one of the most common procedures done in the United States. The procedure we tend to see for people who've had a few things. One, they've lost weight. You lose weight and now you've got some loose skin, and people think if they keep going to the gym and they keep doing sit-ups, that loose skin's gonna go away. It doesn't. Going to the gym helps to tone the muscle, but it doesn't do a thing for your skin. So when people come in with loose skin, either from weight loss or having had children, really the option is to remove it surgically. There are some non-invasive options, and some of those options work okay, but it's a fairly conservative change. When somebody comes in and they're able to pinch skin, or they've got skin hanging over the pants they want to get rid of, usually the answer is gonna be a tummy tuck. Now, it may be a mini tummy tuck, it may be a full tummy tuck, but it's some sort of excisional procedure. The keys to a tummy tuck are, one is we get rid of the extra skin and fat, and two, we tighten up the six-pack muscles that run this way. The classic example is during pregnancy. As the belly sort of expands to accommodate that growing child, the six-pack muscles, which are your rectus muscles, they get separated during that process. And some people, they go back fairly close to where they started, but in a lot of people, or maybe most people, they maintain some sort of separation. The question is it a little bit of separation or is it bigger separation? We call that a rectus diastasis. And fixing that, when you bring that muscle back together, one is that the core works a little bit better because the muscles are better lined up, but two, it helps to redefine the hourglass appearance of the belly. So it's an important step. It's not crucial and you don't have to do it. So some people come in and say, well, I'm afraid of having a tummy tuck because I'm concerned about time off work or discomfort. For those people, you can absolutely do the tummy tuck without fixing the muscle and just focus on the skin and fat. But for a lot of people, it's really gonna kind of polish the result and just make it a little bit better. So typically we do it, but you don't have to. People frequently come in and ask us, what's the difference between a full tummy tuck and a mini tummy tuck? The full tummy tuck gets rid of all the skin from the top of the belly button down to the pubic hair. So it's a substantial amount of skin and fat, and we almost always fix the muscle. With a mini tummy tuck, what we do is instead of making the upper part of the incision at the top of the belly button, we make it about halfway between the pubic hair and the belly button. So you're taking out less skin. So it's really for people who have skin laxity limited to the area below the belly button. If you have laxity that goes above, you really want to do a full tummy tuck. The nice thing is that any stretch marks you have from the belly button down, if you do a full tummy tuck, they're going to disappear, right? We get rid of those. Again, you help to reshape and sort of narrow that waist. When we're doing a tummy tuck, we're often doing liposuction as part of that. The classic areas, we go out into the hips and flanks, and then a lot of people, they tend to store their fat in the lower part of the back. So oftentimes the first step of a tummy tuck when we do that is to put them on their belly, we liposuction that lower back fat, and then we flip them over and continue doing some liposuction in the tummy tuck. What that ensures is that the tummy tuck is going to flatten out the front. By also hollowing out, getting rid of some extra fat here, you define the whole waist. Your waist doesn't just has a front and a back. It's a cylinder. So by improving the entire area, you tend to get a better result. If you're really thin, you don't carry back fat, there's no point in doing that. But for most people, you improve the overall look by treating the belly as treating the entire area rather than just focusing on the front. In terms of recovery, people always ask, well, what's the recovery from a tummy tuck like? What I would say is this. It is probably one of the procedures that we do that's associated with the most discomfort because something has to be the easiest and something has to be the hardest. So this is one of those procedures where I always warn people, you are gonna know that you have this done and you are gonna be uncomfortable for several days. The pain medications we give certainly helps, but people sort of need assistance. This isn't the kind of surgery you do and you go home by yourself. We always require a family member to be with you. We usually try to encourage people to take one of our nurses home so that they can have 24 or 40 hours worth of care. It's nice to have somebody who's professionally trained who can help you to the bathroom and can help you to your post-op visits. We always recommend 2 weeks off work, and if you can take 3 or 4, that's fantastic too. 4 weeks would be luxurious. You don't have to, but 2 weeks is really nice to have. The issue is people aren't able to stand fully upright usually for about 7 to 10 days if you do a full tummy tuck because you're taking a pretty substantial amount of skin. And in order to close that wound, we have people flex. So they have to maintain that posture when they're walking around, and nobody wants to walk around bending over because then people ask the question, what's wrong with you? So we typically ask people to stay home for a couple weeks. With exercise, I often tell people that they need about 6 weeks before they go back to full activity, and when they do go back, you have to go back slowly because exercising won't feel very good when we've repaired that muscle. It tends to be a surgery that people are really grateful that they did, they're really happy about it. It can be very transformative. We often have people come in, they say that they changed by 1 or 2 dress sizes. That gives them a lot of confidence and makes them feel really good about themselves. It's a surgery also that it covers an age range. I've had patients anywhere from 25 to 70 come in asking for a tummy tuck, and as long as they're good, healthy candidates for surgery, there's no reason that age has to be a factor. Really, if somebody's interested in improving the overall contour of the abdomen, it's a great procedure.